Hello there. Come on in, come straight in, please. Take a seat for me just there. How are you? Good. My name's Bryoni, and I'm going to be examining you today. Just confirm your full name for me. Perfect, thank you. And what's your date of birth? Alright, great. Okay, so please tell me a little bit about what you've been experiencing. What's been going on? Okay. And is this why you've made this appointment? Okay. So you're feeling a bit fatigued? Okay. Dizziness? Okay. Alright. Okay, no, that's absolutely fine. Okay. So you just feel a bit low mood, fatigued, tired, exhausted, that kind of thing, low energy, and dizziness. Okay. No, that's absolutely fine. You were correct to make an appointment to come see me, so please do not worry. So, there are numerous things that could indicate why you're feeling like this. I can do a few checks today with a few tools that I have. However, I think, just based on what you've told me, I think it would be good to book you in for a blood test the next time you come. Yes, so I am going to note that blood test. So we'll do an FBC, so full blood count, and we'll check your U's and E's. We'll also check for your B12. And have you ever had a blood sugar sort of check? Check to see if you're diabetic? No, okay, we'll do that. HJ1. Okay. And we will test your magnesium and potassium. Okay, just make a note of what tests I'm going to put you down for your blood test. Just because you're feeling a bit low mood and fatigued, I feel like you may have been lacking some nutrients. What's your dietary sort of like? Do you have any dietary requirements? Are you vegan, vegetarian? Okay, do you eat fruits, vegetables? Your nutrition is very important, yes. Okay, and do you have much calcium in your diet? I am going to check your calcium levels as well, actually, in the blood test. Okay, no, that's absolutely fine. I think I have everything here. We will definitely do a blood test for you the next time. I've just put on there everything I want to test within the blood test, alright? But I think what you've said, it's mainly, we'll do a check to make sure, but I think the blood test will tell us a little bit more, and that might be why you might be feeling low mood. Okay, so for today I'm just going to do a cranial nerve examination. I just want to check that the dizziness isn't because of your eyes or your sort of hearing in your ears, because sometimes that can make you feel a bit dizzy with your sinuses. Okay, and regarding your sort of low mood, low energy, I just want to make sure that everything is okay. Alright, so I will be doing that, and obviously checking your blood pressure as well, because that can be a cause for your dizziness. So we'll check all of that, and then we'll book you in for a blood test. Okay? Alright, so regarding sort of your facial nerve, your eyes, your ears, your mouth, your nose, have you been experiencing anything out of the ordinary? Okay. Any pain at all? Do you have any pain? Okay, that's fine. Anything else you think I should know about? Okay. Alright. Well, don't worry, I'm sure everything's fine. The symptoms you've given are quite common, and just based on you and what you've told me, I suspect you might just be lacking something within your blood test, so that should be fine. Okay, what I'm going to do first, I am just going to check your breathing. Okay, so please just take a nice deep breath in for me. And out. Good. Take a nice deep breath in. And out. Okay. I just want you to try and relax, okay? I'm going to be doing a lot of tests, so just try and be relaxed and don't worry. This is just sort of routine checks. Okay. So I'm just going to have a little listen of your chest, just to make sure your heart and your lungs sound okay. So I'm just going to pop that one on there. I'm going to put that one there. Okay. That sounds okay. I'm just going to pop this behind your back. That sounds fine. I'm just going to pop that on your front and just take a nice deep breath in. And out. Take a nice deep breath in. And out. Okay, that all sounds fine. There's nothing wrong with your breathing. Your chest sounds nice and clear. Okay, so what I'm going to do now, I'm just going to pop this one on your finger. I just want to check your oxygen saturation levels, okay? So all you need to do is just pop your finger in there for me. That's it. So we want this to be above 96%, so 96% to 100% for your oxygen saturation levels. It would typically be lower if you had any sort of defect, so COPD or asthma. So, oh well, your oxygen saturation levels are 99%, 98%. That's very good. And your heart rate is currently at 75%, so it's absolutely fine. I'm just going to take that one off your finger. Very good. Okay. Next up, I'm just going to check your blood pressure. Okay, so I've got a machine here. And have you ever had your blood pressure checked before? You have, good. Okay, so I'm just going to undo the cuff. And if you could put your arm in there for me, that's it. So it's going to go right at the top of your arm, and where the line is, just there on the tube, that needs to be on the inside of your arm, just running along your main artery. Okay, good. So I'm just going to turn this on now. Okay, so it will make a noise and it's going to inflate, okay, and it will go quite tight, just to pre-warn you, so just keep your arm relaxed down by your side. So just going to start this. There we go, it's going up now. So just relax that arm, okay? Okay. So it's quite tight at the moment. Yes, that's fine. That's fine. Give it a few more seconds and it will deflate. So it's just counting down, it's working out your blood pressure. A normal blood pressure should be about 120 systolic over 80 diastolic, but usually anywhere between 110 to 130 systolic and about 60 to 90 diastolic is generally okay. So your blood pressure is on the lower side. It's 106/83. So your systolic is a little bit low, but you aren't feeling too well. Your pulse is actually 77, so that's accurate to the other one. But you've got a bit of dizziness and you're not feeling yourself, so I'm not too concerned. If it was under 100, I would be a bit more concerned, especially as you've been having some dizzy spells, okay? But that blood pressure is generally okay. Alright, so we're going to take this one off. Just take that off your arm. Good. Okay. I'm going to put that in there. Now, I do just want to note that down. So we've done your blood pressure. Do you know your height and your weight by any chance? Or roughly? Thank you. That's great. Okay. Alright. What I'm going to do now, I'm going to begin the main cranial nerve examination. So I've got some gloves here. I'm just going to put these on. Okay. And to begin with, we're just going to do your facial nerve exam. Okay, so I am just going to touch around your face. Just tell me if you feel any pain at all or discomfort or any tightening, okay? I'm just going to check the movement, alright? So we're just going to move that. I'm just going to rub your face. Forehead and your temples. Any pain at all? No? Okay. Just check under your chin and your jaw. Fine. No pain, are you sure? Okay. Feels okay, there's no lumps and bumps. Everything is moving accordingly. While I'm here, I'm just going to feel your ears. And your eyes are fine. Yeah. This is okay. Alright, that all feels fine. Okay. Just move your neck. Just move your face. Good. Okay, that's absolutely fine. I just want to check your movement, okay? Let's just do a smile. And a frown. Good. And a wink. And a wink. And can you move your head from side to side? That's it, move it. And can you move it up and down? Okay. I'm just going to feel your shoulders. Any pain at all? No. Good. Okay. And just smile again. And frown. And wink. And wink. Good. And move your head. Okay, good. That's fine. Alright. What I'm going to do now, I'm going to touch your face with the tip of this, okay? And my finger. Tell me if it's this sharp one or soft of my finger, okay? What I would like you to do is just look straight at my nose, okay? Good. 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 Very good. Okay. And you can feel this? Can you feel that? Can you feel that? Can you feel that? Can you feel that? Good. Can you feel that? Can you feel that? Can you feel that? Okay. Can you feel that? Can you feel that? How about that? Can you feel that? Can you feel that? Can you feel that? Okay. Good. Now your facial nerve is absolutely fine. What I'm going to do now, I'm just going to have a little look into your eyes. Now, I think I'm going to use this one to look in your eyes and this one for you to look at. So we have an orange light and a blue light. Which one do you prefer the look of? I'm going to do the orange one first. Okay, so just look at my nose. I just want to have a little look into your eyes. Good, look at my nose. Very good. Look at my nose. Good, look at my nose. Very good. Eyes look good. Okay, and look at my nose. Just want to check this eye. Very good. Just going to cover this eye. Just want to have a little look into it. It's fine on this side. Just want to have a little look. Okay. Could you just look that way for me? Good. Look up. And look down. And look that way. Good, okay. That's it. Keep looking up. That's it, look up. Okay, look down. Look that way. And look that way. Okay. Alright. Could you just look at the light? Look at the light. 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 Okay. Follow this light. Okay. I'm going to try the brighter light, alright? So I'm just going to try this one. Okay. Look at the light. Good. Look at the light. Good. Look at the light. Look at the light. Very good. Look at the light. 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 Okay. Could you just follow this light for me? Follow the light. Very good. Keep following the light. Follow the light. Good. Yeah, your eyes are fine. Your pupil response is great. Very good. Yeah, that's great. Okay. What I would like to do, I would like you to just look here. 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 Perfect. Okay, look here. 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 Good. How many fingers do you see? How many fingers? How many fingers? How many fingers? How many fingers? How many? How many? How many? How many fingers? How many fingers? How many fingers? How many fingers? How many? How many? How many? Okay. Can you see my fingers? Yep, good. Can you see my fingers now? Good. Can you see my fingers now? Good. Can you see my fingers now? Very good. Okay, your eyes are absolutely fine. They're responding perfectly. Okay. I'm going to do now, I would like you to tell me what colour pen this is. Orange. And what colour pen is this one? Pink. Good. Please follow the orange pen. Follow the orange pen. Follow the orange pen. Very good. Follow the orange pen. Perfect. Okay. Follow the pink pen. Follow the pink pen. Follow the pink pen. Very good. Excellent. Okay. Please could you now read this eye chart for me? So could you tell me what this one is? E, good. This one. L, T, good. Can you read this one? Perfect. And this one? Great. Can you read this one? Good. And this one? Let's get a little bit harder. Can you read this one? Good. And can you read the last one? You did really well there. Okay. What I would like you to do now is just read this one for me. What number do you see? 9. And what number is this one? 5. Good. What number is this? Good. This one? Good. Okay. No, that's absolutely fine. Alright. I'm now going to have a little look into your ears. Okay? Now, you said you had no issues sort of regarding your ears. That's correct, right? No hearing sort of difficulties. Okay. What I'm going to do, I'm just going to look with a bright light into your ears first. Okay. That's fine. On this side. Yep, that looks fine as well. Okay, what I'm going to do, I'm just going to use my otoscope just to have a little bit of a look into your ear. So, just got it here. There we go. Pop that on. Let's have a little look. Okay, your ears look fine. There's a tiny little bit of build up, but I'm not too concerned. I'm just going to have a little look in this side. Again, with that side, there is a tiny bit of build up. I'm not too concerned though. What I am going to do, I'm just going to whisper in each ear, and please tell me, repeat back to me what I say, okay? 1, 8, 5, 7, 4. Perfect. 10, 7, 5, 6, 1. Very good. 8, now just going to have a little look into your nose. So I'm just going to use my bright light. I'm going to have a little look into your nose. So just hold your head up slightly for me. And have you had any difficulty with your sense of smell? Okay. Alright. Okay. Your nose looks fine. What I do have is a little bottle here. I would like you to just give this a smell and tell me what you can smell. What's that? Good, that's great. Well done. You did that one perfectly. I've got another one here. This is slightly different. Just give that a smell. And what's that one? Brilliant, well done. Okay, there's no issues there. Alright. Let's have a little look with this light. Just up your nose. Yeah, your nose is fine. Just do this for me. Very good. Yeah, that's all okay. Alright. Now if you could, I'm going to have a little look into your mouth. So please just open your mouth wide, okay? I just want to have a little look. Good. Lift your tongue for me. Good. And just say, ah. Ah, very good. Okay, that looks fine. I'm just going to use this light. Open your mouth. Just want to check your tonsils. Yeah, they look fine. Okay, that looks okay. I have got a little tool here. I just want to have a little look at your teeth, okay? So I've got a selection of tools and I'm just going to have a little look at your teeth. Don't worry, I'm an expert at this. I'm not going to hurt you at all. So we're going to use this one. Okay. Just open your mouth. That's fine. That's all good. Your teeth are all fine. How is your sense of taste? Okay, what I would like you to do is taste these. These are different to the ones you smelt. So I'm just going to put a little bit in here. Okay, and if you just open. Okay. There you go. What's that one? Good, well done. Okay, this one. Okay. Open your mouth. And what's that one? Good, well done. Okay, wow, you have done extremely well today. I've checked absolutely everything. Your breathing was fine, your sound was fine, your heart rate was fine, your blood pressure was fine, your facial nerves absolutely fine, your eyes, wow, your pupil response was great. Your ears are great. You've got a tiny little bit of build up, but I'm not too concerned. And your nose is fine, and your mouth is okay, your tonsils are fine, tongue's fine, sense of smell is good, and your taste is good. Okay, so I'm not really too sure why you're feeling a bit low mood, fatigued. The only thing I can think of is whether you're not sort of eating and drinking is what you should be. So what I will do, I'm going to book you in for a blood test, okay? And we're just going to check a few things to make sure your levels haven't dropped. But you will get informed about that. You'll get a letter in the post, okay? But that's everything for today. Everything I've done, you're absolutely fine. I don't think there's anything to be concerned about too much until we get those blood results back, okay? Now, if you do feel worse or your symptoms get worse or new symptoms arise, please do come back and get yourself checked out, okay? Alright. Well, thank you so much for coming to see me. It's been my absolute pleasure. Alright, well, take care. Bye-bye. Oh, hello there. Please come on in. Make yourself comfortable. My name is Bryoni. How are you? Okay. Well, I understand you're here for a eye checkup. Okay. To check your colour deficiency, is that correct? Wonderful. Well, you're in the right place. Okay. Well, I'm just going to put some gloves on. Now, have you been experiencing anything unusual regarding your eyes? Anything out of the ordinary? Any difficulties or struggles? Okay. Have you had any symptoms with your eyes, such as redness, watering, discharge? Okay. Any sort of like gunk or anything? Okay. How about your vision? Any difficulties? Blurred vision? Double vision? Okay. Well, I don't think you'll have any problems, but I am just going to do a quick check over of your eyes, and then we'll get started with the colour deficiency test. Okay? Wonderful. Okay, I'm just going to come closer, have a little feel around of your eyes, okay? Wonderful. Okay. Any pain or discomfort? No? Okay. Do let me know. Your eyes look fine. Okay. What I would like you to do is just look here. 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 Very good. Can you see my fingers? How about now? Okay. Can you see them? Now? Good. Very good. Okay, tell me when they go out of your vision. Okay? Okay. Good. Very good. Alright. How many fingers do you see? 4. How many? How many? How many? How many? Okay. How many? How many fingers? How many? How many? Okay, that looks good. Alright, what I'm going to do, I'm just going to have a little look into your eyes. Now it is quite a bright light, so I don't want you to look directly at it, okay? Look over here on my hand or something. Alright. Okay. Look at my hand. Do not look at the light. Do not look at the light. You've got very good pupil response. Okay, look over here. Do not look at the light. Good, look at my hand. Okay, could you just look up for me? Okay, look down. Look left. And look right. Okay, your eyes look fine. Could you now just look at the light and follow the light, okay? Keep following the light. Wonderful. Okay, what I'd like you to do is just read this eye chart for me. Okay, so what's this letter? Good. 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 Okay, do you want to try the next one? It's getting difficult now. Good, okay. What colour is this? Square, rectangle box. And this one? Okay. Now, could you just tell me what colour this is? It's an orangey red. Well done. And this one? Green. Okay. Can you follow the green pen for me, okay? Just follow the green pen. Good. Okay, follow this pen. Keep following. Well done. Okay, I'm going to begin now with your colour deficiency test. Okay, your eyes are fine generally. So, what I'm going to do first, I'm just going to pick some colours out. And I want you to tell me what these colours are. Okay, so I have got 5 colours. Now, I want you to tell me what the colour is and describe something that is that colour, okay? So, what colour is this? And can you tell me something that is this colour? Good. Okay. What colour is this one? Good. And can you tell me something that is this colour? Very good. Okay, these are slightly tricky now. What colour is this? Excellent. Now can you name something that is this colour? Good. I was thinking elephant. Okay. What colour is this one? Okay. Can you tell me something that is this colour? Good. I was thinking carrot. And finally, this colour. How would you describe it? And can you tell me an object that might be this colour? Or slightly this colour? Or just something? Good. You've done really well with these. These ones were quite tricky actually. So next up I have got this book which has lots of different pictures in colour. So they're like this, and there's a number in here. Okay, this one is quite easy and they do get harder as we go along. Some of them are designed to trick you. Okay, so could you tell me what you see in here? What number? 12. Very good. Going to move on to the next one. What number do you see here? Good. How about this one? Very good. What number do you see here? This one's quite tricky. It's 57. What number do you see here? Okay. How about this one? This one is designed to trick you. What do you think it is? It's 3. What do you think this one is? Good. How about this one? Okay. What do you think this one is? Good. How about this one? What do you think this is? It's 45. This one? Can you tell me what this one is? 7. Okay, we're gonna come into some tricky ones. Can you describe what you see in here for me? Do you see a number? Okay, no worries. How about this one? What number do you see in here? Or do you see something else? Okay, let's try one more. What do you see in this one? Do you see a number or an object? Okay, good. Please do not worry. They are designed to trick you, the ones towards the end, so you have actually done really well. Pop that back. Okay, now we're going to move on to the quite difficult part. You have done really well up until now, and this is the last thing I'm going to check. Okay, now this one, please do not feel bad if you get some of these wrong. It's designed to be extremely difficult, okay? But I'm sure you'll get some. So I'm going to pick out a colour from here, and I need you to tell me the exact colour. Now they do have names on the top, okay? Some of these are quite tricky, some of these are easy. So what colour is this? What colour is the pen? It's black, okay? So that one you have got correct. So the next one, what do you think this colour is? What shade? This one is actually called sap green. Okay, quite difficult, I know. What about this colour? What do you think this is going to be called? This is grass green, okay? What do you think this colour's called? This one's quite easy. Go with your gut. It's light blue. Okay, do a couple more. What do you think this colour's called? It's called stone grey. Let's do one more. What do you think this colour is called? It's a very beautiful colour. This one is called English red. I told you these are extremely difficult. You did get a couple, I believe, so that's wonderful. But this is the end, okay? You've done extremely well. I don't think you have anything to worry about. Should you develop any symptoms of any kind regarding your eyes, please do come back to see me, okay? Wonderful. Well, take care and enjoy the rest of your day. Bye-bye. Oh, hello there. My name's Bryoni. What's your name? Wonderful. No, I've been expecting you. Please do just make yourself comfortable. Can you tell me what you've been experiencing? Okay, no, that's fine. I don't think it's anything to be worried about, but I will just give you a check over. Okay. So, is it more your face, your Sure. Okay. Alright. No worries. First of all, I'm just going to pop some gloves on, and then I am just going to come closer, just examine your face, your skin, and just make sure that it's okay. Alright? Wonderful. Okay, I'm just going to come a little bit closer. Okay, I'm just going to have a little look at your face, and I may just feel around. Okay, so just stay looking at me. Just turn your head the other way. Turn your head the other way. Alright, I just want you just to do this. Okay. Let's again. And again. Did that hurt at all? Alright. I'm now just going to feel your face. Okay. Okay. Any pain or discomfort? No. Alright. What I want you to do now is just do some movements for me. Okay. So first of all, just move your head from the side to the middle, to the side, to the middle, side, middle, then up and down, up and down, then the side and the middle, the side and the middle, and up and down, up and down. Good. How does that make you feel? Any dizziness? Any pain? Okay. Alright. Now we're just going to do some facial movements. So do a big smile for me. Bigger. Bigger, 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 bigger. Good. Now do a frown. More. Good. Can you wink? And the other side. Good. Now just puff your cheeks. Good. Puff your cheeks. I'm just going to put a little bit of pressure. Puff your cheeks. A little bit of pressure. Good. Now can you do this? Very good. Okay. Just stick your tongue out and move it from side to side, side to side. Good. Okay. Alright. I'm just going to massage your face a little bit, okay? Just let me know if there's any pain or discomfort. Alright, I'm just going to touch your face. Let me know if it's sensitive, okay? Good. I'm just going to scratch the skin. Let me know how it feels. Perfect. I'm just going to use a light. I just want to examine your skin, okay? You can either close your eyes or just look directly at me, but don't look at the light. just going to look in your mouth. So just open wide. Okay. Oh, okay. Just a little bit red and inflamed. Okay. Right. Okay, to lift your tongue and move your tongue from side to side. Yeah. Okay. Can you just open your mouth wide? Go. Ah. Okay. Now just do this. And again. I think for you, you need to have a dentist appointment. Yeah, and just have a little look into your mouth. Okay? I don't think it's anything to do with your facial nerve and movement, but I think it might be more here, and it might be sort of your gums that's causing that. Yeah. So I definitely recommend having a full dental check. Okay. Right. However, I'm just going to do a full sort of facial nerve check anyway, just to be sure. So this one requires just a little scrape on your skin, and I want to see how your skin reacts. Okay? So I'm just going to scrape, 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 scrape. 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 Lovely. And now I'm just going to use this little brush, and I'm just checking how well your skin reacts, okay? So just a little brush, 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 brush. Brush, 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 brush. Brush, 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 brush. Perfect. And now this one, it's a lot lighter, a bit like a feather. Okay, and it might tickle a little bit. So this one's a lot softer, but I just want to see how your skin reacts, okay? So just might tickle, tickle, tickle. 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 Oh, hello there. Please come on in and take a seat for me, just there. My name's Bryoni, and you're here for your audiology test. Okay, so first of all, I just need to fill out this form. Okay, so could you just tell me your surname? Okay, and your first name? Great. And what's your date of birth? Thank you. And do you know the name of your GP practice? Okay. Great. Okay. Now I just need to ask you some random medical questions and questions about your hearing and your ears. Is that okay? Good. Alright. So once we've done all of these questions, we will then begin the tests. Okay? Shouldn't take too long though. So do you live alone or with somebody? Okay. And what's your occupation? What would you spend most of your time doing? Okay. And have you noticed any difficulties while doing your job regarding your hearing or your ears in general? Okay. I guess, does it affect your day-to-day activities or whatever it is that you're doing? Okay. So this is just a checkup pretty much. Okay. Alright, so let's have a little look. So, how long would you say you've had some sort of problem with your hearing? I don't want to use the word problem because sometimes things can be difficult to hear, and that's okay. But how long would you say? Okay, not too long. It's good you came to get assessed. And which is, or is it both, do you struggle most with? Okay. Great, thank you. So the next set of questions are just yes or no, and these are just generic questions that I have to ask you. Okay? So have you had any sudden or rapid changes in your hearing within the last 90 days? Okay? Does your hearing change on different days? Okay. Do you get pain in your ears? Okay. Do you get any infections or discharge from your ears, not including wax? Okay. And have you had any ear-related operations? Okay. Have you ever had a perforated eardrum? You'd know about it if you did. Yes. And do you hear any rushing, hissing, ringing, beating, pulsing, or any other noises in your ears? Okay. And do you have a strong sensitivity to everyday loud sounds that typically do not bother other people? Okay, so sometimes. Which noises are they? Loud music? Right, okay. Alright, that's fine. Thank you. Do you ever see a ears, nose and throat ENT specialist? Okay. Do you have hearing aids? Okay. And do you ever get dizziness or any problems regarding dizziness? Okay. Alright. We're nearly there. Okay. So, I have some more questions to ask you. These are yes or no questions again. So, have you ever been exposed to significant noise in your life? Has anyone in your family had a hearing loss not associated with aging? Okay. Do you have any skin allergies? Okay. Do you have any altered sensation in your face, like numbness or tingling or droop? I don't think you do. Have you ever taken any medication that you were told may affect your hearing? Okay. Have you had any injuries around your ears or your head? Okay. Do you have any problems with your eyesight, with or without glasses? And how severe is that? Okay, it's fine. Do you have problems with the feeling or movement in your fingers? For example, do you have trouble doing up buttons or unscrewing things? Okay. Do you have any difficulties with your memory? Okay. Alright, so let's just double check. Okay, so finally the last set of questions are about your hearing difficulties. So these are if your hearing is affected in these kinds of situations, okay? So again, just say yes or no. So I'm going to give you one of these. For example, one-to-one conversation in quiet. Do you have difficulty hearing in one-to-one situations? Okay. How about conversation with noises? Sort of background noises? Okay. Do you have any difficulty hearing the television or radio at a normal volume? Do you ever have difficulty hearing a familiar speaker on the telephone? How about an unfamiliar speaker? Sometimes. Do you have difficulty hearing the doorbell? Or knocking? Okay. Do you have difficulty hearing traffic? You can hear the traffic now? Well, that's great. How about hearing the fire alarm? Okay. Alright. I'm pretty happy with the results so far. I don't think there's anything that I'm sort of immediately concerned about. However, I do have a few things that I am going to do. First of all, I'm just going to put some gloves on. And I'm just going to have a little feel around of your ears. I will then have a little look in your ears, just to make sure I don't see anything that concerns me. I will then just conduct a few hearing tests. One will be whispering into your ear, okay? And I will then do some sort of hand movements to see if you can hear them. And then also I have a little machine here, just this machine, and it will play some sounds and I will change the volume, and I just want you to tell me if and when you can hear it, okay? So that's how the rest of this will go, alright? So I'm just going to touch your ears. Just want to have a little feel. okay? Do you have any pain at all? No. Okay. Your ears feel fine. There's no lumps, bumps, and they don't look red at all. Your ears look okay. Yeah, and there's no pain when I'm touching. No. Okay. You don't have any pain sort of here on your face? No. What about sort of under your jaw here? Any pain? No pain. Sure? What about your cheeks? Any pain? No. Good. Alright. I'm going to just have a little look with this light and this tool. Okay, I'm just going to have a little look. That ear looks okay. I'm just going to check this side. Good. This one looks fine as well. Alright. What I'm going to do, I'm just going to use my light with a magnifier on. Going to check the other side. They both look okay. Did you hear the car? Yeah, okay. I'm not really concerned at your hearing, but let's have another little look. I'm going to use a bigger magnifying glass, okay? Just want to have a little look. Yeah, that looks fine. Just gonna have a little look with this light. Yeah, it's fine. This side. Yeah. Okay, your eyes look fine. I'm not concerned at all, actually. Okay. What I'm going to do next, I'm going to whisper into each of your ears, okay? And just repeat back to me exactly what I say. Alright? Hello. My name is Bryoni. What did I say? Very good. Okay. I hope you've had a very good day today. What did I say? Very good. Okay. Coconut, mango, apple. Coconut, mango, apple. Very good. Excellent, well done. 10, 5, 2, 1. Good. 8, 7, 4, 5. Perfect. Let's do 2 more. Happy, sad, good. Hello, 5, cat, 10. Very good. Okay, what I'm going to do now, I'm going to hold my hands like this, and I am actually going to move them, and I want you just to tell me which side you can hear the sounds, okay? So left or right? Alright. Which side? Good. Which side? Good. Which side? Which side? Look at my nose. Which side? Good. Which side? Which side? Which side? Which side? Very good. Which side? Which side? Which side? Which side? Both? Which side? Good. Which side? Which side? Which side? Which side? Okay. You did really, really well there. Okay. So your ears are fine. Okay. You've passed those 2 tests. And finally, the last test is with this machine. Okay. Now it might be a tad bit loud. So what I'm going to do, I'm going to play a sound, and I want you to tell me what you can hear, okay? Alright. Okay. What do you hear? A song? Good. Okay, let's change it. What do you hear now? What do you hear? Good. What do you hear now? This is a bit louder. Is it the same on both sides? Good. Okay. does this sound like to you? Good. What does this sound like? Water. Bubbles. Boiling. Very good. What does this sound like? The waves. It's water. Good. What does this sound like? Fire crackling. Very good. What does this sound like? Very good. And finally, what does this sound like? A clock. Very good. Well, I think you have done extremely well there. I don't think there's any problems at all with your ears, and your hearing is fine actually. Very good hearing, extremely good hearing actually, for that matter. Everything's fine. I think we're going to do another checkup maybe in a few months. I do ever so quickly just want to measure your ears. Okay. Yeah, your ears are fine. So everything was absolutely fine today. You've responded really well, and I don't have any concerns at all. Do you have anything for me? No? Well, you are good to go. And yeah, please do not worry. If anything changes, please do come back and see me. But other than that, I will request to see you again in a few months. Alright? Very good. You are more than welcome. Take care. Bye-bye. Bye-bye. Oh, hello there. Please come on in, take a seat and make yourself comfortable. Just confirm your date of birth for me. Wonderful, thank you. Okay, so what brings you in today? Okay. And just tell me a little bit about what you've been experiencing. Okay. Is it painful? Okay. And when did it start? Okay. Have you tried anything to relieve it? Okay. And would you say you've got a fever or a cold or anything at the moment? Okay. And are you up to date with all of your vaccines? Okay. And have you been experiencing any blood vision, double vision, any watering in the eyes, any discharge of any kind? Okay. And how's your sense of taste and smell? Okay. Lovely. Have you been getting any ear pain? Any tenderness around here? Okay. And regarding your muscles, any tension, spasms? Okay. Lovely. Okay. Well, do just relax back where you are. Okay. I'm just going to put some gloves on and then I will just give you a bit of an examination, okay? Alright. Got my pink gloves. I much prefer the pink gloves, adds a little bit of colour. Yeah. Okay. Okay. So I'm just going to come a little bit closer, okay? I'm just going to have a little feel around of your face and your body, okay? Just to make sure there's no tension or anything. Do let me know if you have any pain or discomfort, okay? Any pain or discomfort? Okay. What about on the top of your head? Any pain or discomfort? Alright. Okay, I'm just going to feel your face. Can you hear the birds? This feels fine. Any pain or discomfort? Okay. Okay, your head's generally fine. Would you be able to just move your head for me from side to side? Does it really stretch? Good. Side to side. Side to side. Okay. And now can you do it up and down? Good. Any pain or discomfort? Wonderful. Okay, so I'm just going to feel your shoulders. Okay. And then your arms. Okay. And just the rest of your body. Just let me know if you have any pain or discomfort. Okay. Shoulders are fine. Can you just lift your shoulders up and down, up and down? Good. Can you rotate your shoulders? Good. Okay, I'm just going to feel your arm. Again, do let me know if you have any pain or discomfort. Generally feels okay. On the other side. Okay. That feels good. Alright. Can you just do this for me? Good. Can you do this? Can you do this? Can you do this? Very good. Okay, I'm just going to feel your chest, put a bit of pressure on, and I'm just going to push your tummy, okay? Again, let me know if you have any pain or discomfort. Good. Good. Okay, I'm just going to push your tummy. Good. I'm going to put that pressure on. Good. Okay. That all feels fine. Okay, everything is looking really good at the moment. Yes. I'm just going to listen to your chest. Please do just breathe normally for me, okay? Okay, just gonna pop this one here. Good, just breathe normally. Good. And the other side. Good, and just here. Perfect. Now if you can, just take a nice deep breath in and out. Take a nice deep breath in and out. Good. Okay, I'm gonna have another listen. Okay, I'm just gonna pop that there. Breathe normally. Good. Okay, now take a nice deep breath in. Good. Take a nice deep breath in. Very good. Just do a cough. Good. Breathe normally. Good. Okay, that all sounds absolutely fine. I'm not concerned at all. Doesn't sound congested or anything. Okay. Now what I am going to do, I want you just to read this chart for me, okay? Just the numbers that you see here. So what number is this? 9. Good. And what's this number? 5. Good. What's this one? 8. And this one? 7. Good. And how about this one? 4. Good. What about this one? 2. This one? 8. This one? 4. 3. Well done, that was really good. Okay. What I'm going to do, I'm just going to have a little look into your eyes. I just want to make sure they're okay. So I've got a light here. Okay, now just look straight at me or over here. Do not look at the light, okay? Do not look at the light. Do not look at the light. Look at my hand. Okay, just blink, blink, blink. Okay, look over here. Again, do not look at the light. Do not look at the light. Look straight at me. Good, look straight. Good. Keep looking straight at me. Just look straight. Do not look at the light. Look straight at me. Do not look at the light. Look over here. Look at my hand. Okay, look over here. Look at my hand. Do not look at the light. Okay, now you can blink, blink, blink. Alright, just look up for me. Look up. Okay, look down. Look that way. Look the other way. Okay, good. Look up. Look that way. Look the other way. And look down. Okay, look up. Look left. Look right. Look down. Good. Okay, look up. Look left. Look down. Look right. Good. You can blink, blink, blink. Okay, look at the light. 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 Okay, I want you to now follow the light. Follow the light for me. Follow the light. Good, blink, blink. Gonna try it on this one now. Okay, look at the light. 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 Okay, now follow the light. Very good. You can blink, blink for me. I want you just to look here, look here, look here, look here, look here, look here, look here. How many fingers am I holding up? How many? How many? How many fingers am I holding up? How many? How many? How many? How many? How many? How many? Very good. Okay, follow my finger. Follow my finger. Okay, follow this finger. Good. Tell me when you can see my fingers. Good. 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 Very good. Now tell me when you can't see them. Good. 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 Very good. You can blink, blink, blink. You're doing really well. I'm just going to use this, and I want you to tell me if you can hear the sounds in both of your ears, okay? It'll be very gentle, do not worry, okay? But it's just like a ringing sound, okay? Ready? Did you hear that? Try again. Did you hear that? Perfect. And this side. Did you hear that? Okay, again. Did you hear that? Lovely. Now tell me if you can hear this. Did you hear that? Perfect. going to test. I'm going to make some sounds behind each ear. I want you to tell me which side you can hear it, left or right. Ready? Which side? Good. 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 Very good. Okay, you did really well there. I don't think the issues with your hearing or your ears at all. Okay, I think you could do with a blood test. Yes, and perhaps a full eye check with different lenses and things. I think your headaches might be because you might need some glasses, or you might need just a change in prescription, or alternatively, you might just need a deeper look into that. I think that's the issue. Okay, I am going to check a couple more things. I just want to check that you haven't got a temperature, so just look straight at me. Good, now your temperature is absolutely fine. And finally, what I'd like you to do, I want you to just sniff a little bit of this for me and just tell me what you can smell. What does that smell like to you? Good, well done. Now I want you to taste this bit, okay? So I want you just to stick your tongue out. And just, what does that taste like to you? Very good. Well done. Well, I think everything is actually fine. Okay. I'm just going to take these gloves off. What I think for you, you just need some rest, keep yourself hydrated, and I'm going to book you for a thorough eye check and a blood test. Okay? So I'm just going to make note of that. You're for a blood test. That will be next week. And an eye test. Perfect. Well, that's you all done. Please do not worry. Take it easy, rest, and keep yourself well hydrated, okay? You're more than welcome. Take care. It was lovely seeing you. Bye-bye.